So let's start the discussion. Dame Parveen, that was a really interesting conversation which opened up the idea. Also got to start thinking about what the textbook is. And I think that prompted this first question up there, which is really about the definition of the textbook. So I'm going to have Prof. KK Luke start us off on this question. Prof. KK, as a linguist who has studied the word, right, how has the definition changed? What's the definition of a textbook these days?
Of course, as Parveen just showed us, the idea of textbook has undergone tremendous changes and transformations over the years anyway. So what we now mean by textbook can range from the traditional paper copy to a whole variety of online resources, and all linked up in wonderful ways and very interactive and so on. So there's no doubt in my mind that, you know, a combination of these formats will be still essential to medical education, to any education at the university level. Nevertheless, as Parveen also showed us on the last slide, the textbook is just where you begin, I suppose. It's the basis of the knowledge. But where you end up and where you want to go must come with the patient. For the doctor, there's always the patient. In linguistics, we talk about, sometimes we talk about membership categorization. In other words, we describe and we think of people around us inevitably, sometimes, in fact, all the time almost in terms of categories, like doctors and patients and police and thieves and so on. One interesting property of these categories is that very often they come in pairs or they come in groups. So the doctor-patient categories are actually a very good example of paired categories. And there is a reason, of course, to the pairing, because the doctor is not a doctor without the patient, and the patient comes to see the doctor. And so in medical education, it really comes across very clearly, I think, in Parveen's lecture, that there's nothing more essential, more important than the doctor-patient interaction and the doctor-patient relationship. And so from the community's point of view, what we need is not a bunch of technicians graduating from the graduate school every year with a lot of knowledge, with a lot of latest scientific information and skills, but more so a group of professionals who not only know their medical stuff, but also who are good conversationalists, who are empathetic, sympathetic, and compassionate people who the patients can talk to. And this trust and confidence in the doctor, I think, is essential to a good and excellent healthcare system. Perhaps I stop there for now.
Okay, thank you. Just want to ask whether anyone wants to respond to that?
Perhaps I can just start by saying Naomi invited me to be on an expert panel, and I thought, what's my expertise that I'm coming on this panel for? And then we heard this morning that the human condition is associated with imperfection, and I thought, yep, that's my expertise, imperfection. My clinical career has been in family medicine, and that is associated with imperfection, because it's all about undifferentiated disease. And Parveen, you gave us so many wonderful examples of the importance of working with patients. And for my clinical life, I think it's that's been more important than the textbooks. And my textbooks have lain on the shelf gathering dust since I didn't use them in medical school.
So a couple of ideas, perhaps. I think, first of all, there is this, it seems that the disruption comes from two positions. One is from the textbook industry, where they're rethinking the textbook, and you show how you're disrupting the textbook by creating a digital version of it that is more interactive and gives a different value or an additional value to the physical attribute. Another place where the disruption comes that also moves into the digital is the classroom itself, and the question of where we learn and how we learn. Recent research by Pearson shows that Generation Y and Generation Alpha, which is now the next generation that will come into the classroom in the next 5 to 10 years, they value the classroom very much, the physical classroom. But at the same time, when they're asked where they gain a lot of knowledge, 74% of them, I think, say that YouTube is one of their most important sources of knowledge. And I think what you did is put the curation on it. So I think that is a key point, is how do you bring the textbook into the digital, and then how do you bring the classroom in a blended form into the digital? And I think in that fault line is where we're sitting. So from my perspective, we're developing online courses, which we see as essentially creating the virtual textbook from a classroom perspective, and you've done so from a textbook perspective. And if we can merge those two worlds, I think we're in a good space. And another aspect that I think is really important when we look at the digital, and that's why I mentioned the YouTube example, although it's not free and there are ethical implications that we can unpack, the idea of democratization is very important. And I think we have to be mindful that, you know, the publishing houses do have a monopoly to a degree on the textbook, and this ability to break that open by opening up the lecture and rethinking the lecture like we are rethinking the textbook, I think that's where we have an interesting space for debate.
So hold on to the mic a minute, Gideon, because that relates a little bit to the question up on the screen, which is really, with this blended textbook and interaction, which is coming with textbooks, etc., who owns the textbook? Or perhaps even more interesting, who should own the textbook? So maybe we can, your opinion on that, and we can follow up with Adrian's and Parveen and then Luke.
Well, that's an interesting thought. One of my problems with textbooks and editing is, where did the author get the source from? Because and you know, there's one awful time when we always put it through a check that there hasn't been duplication. And there's one occasion where we found, we realized it wasn't the same writing. So we looked at it, and my co-editor, who's very good at seeing what's around, said, look, that's absolutely identical to somebody else's work. And then how do you tell a respected colleague that this is not right? And I sort of, eventually, I got the editor, the publisher to do that, but I said to him, you know, Lasha sort of said, look, you know, you've done this, you know, you should really take it out and change it. And I said, look, I don't want to go to jail, you know, with you. You can go yourself if you like, but I don't want to be there. So I think it's very difficult. So who owns the copyright? The copyright, anything I write, will go to elsewhere. There was one famous physician who I think wrote for another textbook who would never give the copyright. But his chapter was so good, they allowed him to have his own copyright. So who owns it? It's theirs. So whatever you write, even though it's your personal thing. And I have this problem that if you're writing, you've got a certain set of expertise. If you're now writing the same expertise for another group, you're going to put some of the same thing in. Is that now be breaching copyright or something that it was my thought? You know, I don't know.
Thoughts from the panel?
I think it's not who owns the textbook, but it's who owns the knowledge. And I think that the great thing that we still have in our academic communities is that we are very willing to share our knowledge, to share our research. And I think we need to be cautious about the pressures that there are on commercial intellectual property and so forth. And we need to hold together as a community that we do share that knowledge.
You're right.
Let's look at the next question coming up here. So, given that we don't own the knowledge and the knowledge keeps expanding, right? How do doctors and students catch up with their expanding knowledge? And Adrian, since you have the mic and as a medical educator, what's your take?
Sorry.
What's your take on helping your students deal with this ever expanding knowledge base?
Well, I think that this is about transforming medical education, and it's about acknowledging the rapid changes that are occurring. And we're talking about putting textbooks online. I think we should be thinking a bit further forwards from that, and maybe I've got my Google specs on, and as I look at a particular word or a particular patient, suddenly the knowledge is being flashed in front of me. But I don't know, but Gideon, you're much more associated with the cutting edge of this.
So one way of looking at it, perhaps, the biggest online course right now, the one that has most learners in the world, is not a course on machine learning, it's not a course on engineering, it's actually the course called Learning How to Learn, with over 2.8 million people taking that course. And I think that speaks to some underlying theme that is about do we actually teach students when they enter the university how they actually learn, and what is the place of the textbook and how you interact with that. And I think that is an important theme, and perhaps all universities should have a course like that to start with, to teach people how to learn and how to continuously learn. And then we open up into the CPD or lifelong learning.
You could argue, from what we just heard, do you need to learn anything at all? So to the patient, the symptoms go in, and your Google eyeglass tells you there's the diagnosis, this is the treatment. So why bother? Why don't we just disband it? No education.
So I think that's a very good point. The question is not so much if we have to learn, but what we have to learn then. So maybe it's not the physiology, or maybe it is the physiology, and maybe it's something completely different. Maybe it's more ethics, and maybe it is more the compassion part of things rather than the technology. But I'm not the content expert, so it's really about for me, it's more about like the how we learn. And we need to embed pedagogy into our equation. And actually, I would love to have a deeper discussion about how pedagogy is embedded in the way you've structured the textbook, and how the textbook then in an online version can be the best pedagogical version of itself almost to the students.
It seems to me that we're really now at a juncture when we should seriously rethink our whole approach to education in the university, including medical education, but also probably, what I'm going to say probably applies to computer science, engineering, and so on. And it's a simple fact that, for example, how knowledge is increasing exponentially, the massive explosion of knowledge and information, so that within the time that the students spend at the university, even 5 years, of course, is a very long time for the medical students. For other students, maybe 4 years, maybe 3 years, still a limited time. And so the content knowledge that we want the students to learn within that time, first of all, it's not going to last them too long after graduation. And therefore, especially for medical education, this will mean, of course, continuing education, lifelong learning, and so on, which UK, Singapore, and other countries, of course, already doing a fantastic job. Nevertheless, this, I think, would give us an opportunity now to consider the curriculum itself. So within the 4 years or 5 years that we have, how best to make use of that time? And I would argue that for a medical student, perhaps previously, there was perhaps too much time spent on the content, teaching, and lecturing. And of course, the trend is now everywhere for less teaching of content, but more learning of skills and so on. And I would say that in that sense, that perhaps this, more room could be made available for our medical students to do a course or two in the humanities or a course or two in the arts. That way, they would become better conversationalists, as I said at the beginning. And this is what ultimately is going to make a difference when they come out and serve the healthcare system. Because the knowledge they can keep learning. Every day, there's new knowledge. But the novels and the histories and the philosophies that they read when they're students at university, these are young minds that will open up to these challenges at a time when they have the environment to absorb and to reflect on these things, rather than leave it too late.
The question was really, how can we, sorry, I've got one of these, how can we keep up with the knowledge, I think. So how can we keep up with the knowledge? You know, have a different brain every 73 days, or?
There is some research about brain upload, but I'm not sure that's going to happen in the next 5 or 10 years. It's kind of out there. But this idea that knowledge is at the finger, I mean, I guess from data to information to knowledge, that we can cover. The problem is the step from knowledge to wisdom. And that's that we hope to do something in the university, but I don't think we have the right, we don't actually know what happens there in that transition stage. Yeah. But the fact that I'm old, I guess.
Not as old as me.
But I remember having an encyclopedia in my house, and that was a great thing. And that was a huge invention at the time. The fact that you can have it in your house and not in the library, and now you have it on your cell phone. Your book is on someone's cell phone. Then the question is, okay, what does that mean for the way we interact, and what is the knowledge then that I do have to have as a basis? Because the criticism is that we then only train very shallow people that have great skills and great behavior, but if you can't go to depth, and I'm on the one hand, I'm the evangelical person that thinks, oh, technology is fantastic, but I can also see the downside when you walk through a museum and you see a lot of kids staring at their cell phones rather than to watch at the pictures or take pictures of pictures, so to speak. So then the question becomes, what is literacy in a digital age? And how do we train for that? And should we train for that?
So that sort of thought struck me with your digital stuff. 10% to err is human, right? 10% of the decisions we make are going to be wrong. Now, I got on a plane in London yesterday. Now, if you told me, well, fine, Parveen, you've got a 90% chance of getting there, but 10% you're going to crash, would I get on the plane? And so coming back to your digitalization, what we need to do is to stop mistakes as well, because that's where litigation goes in, and that's where we're spending a lot of money. So can you suggest to me how, with your digitizations, we can reduce the number of risks that a human makes?
So I think that's really by the design of the program, and every question begs a different design. And that's why developing new education costs a lot of time and effort, because it's no longer this one person looking at the education space, but it's a team of people, ranging from pedagogy experts to people who understand visuals, people who can film, and the content experts, the academics, working together to create that content that suits the needs of the learners. So that's an important inflection. And then at the same time, if you take the classroom and put that in your textbook, rather than the other way around, perhaps the pedagogy helps create the right kind of flow for students to at least understand when they make mistakes, where and how.
And I say one additional partner we often forget are the students themselves, right? And the students themselves do all kinds of things to your textbook, to your notes. Their seniors' notes which float around quite a bit, and that forms an important part of their learning, as asked by this question. I want to ask Adrian, what are your thoughts of students' and seniors' notes as a form of knowledge resource, as opposed to the textbook?
Who are you asking?
Well, that's great, because I don't know, what are senior notes?
So that's when students have made these customizations to the textbooks, and then they condense it, and then it gets handed down as the tome of knowledge year to year. So the students are very much part of this creation of knowledge.
No, I remember when I skipped the lectures, I used to try and find people who'd been and say, can I see your lecture notes? I didn't learn anything from that. I think, Gideon's talked about learning how to learn, and learning how to learn is not actually just taking stuff from somebody else.
Okay. So we have a couple of questions at the microphone. Can I start over here, please?
Okay, thank you. Helen Ward, I'm Director of Education at the School of Public Health at Imperial College. And thank you, Professor Kumar, for a fantastic presentation, very thought-provoking. And I was very taken by your comment about someone who could list the 20 causes of whatever it happened to be. And it takes me back to when I was examining medical students at finals, and I had exactly the same problem, that there was no context for the learning. There was just a list. And actually this list was the wrong way up. It was a chest pain list, and the student had the most rare causes at the top. And, you know, the question was, you know, a 68-year-old overweight smoking man who was, you know, what do you think the chest pain's caused by? And, you know, it wasn't very likely to be what he said. It was actually, you know, we just wanted them to say, well, you have to rule out that it's an MI, but they couldn't get the right order. And so I think when we talk about knowledge, it's important we don't just say, how do students get the knowledge? It's just, how do they use? I think you're right, you can access the knowledge, which may be developing very rapidly. I think I would put it the other way around. 98% of what you need as a doctor is not cutting-edge new knowledge. It's actually knowledge we've had for quite a long time. It's the application of that together with the context, what matters to that patient, what they're presenting with specifically, and all the other bits of information. And your task is then to work with that patient to solve the problem. And the problem frequently is people, particularly working in open access and primary care type settings, the problem is often not the pathology, the problem is something else. And that problem solving, that's what we have to be able to help people to learn as through medical school, so that they come with a holistic approach. Like you, I was not very keen on problem-based learning, because you think from what I just say, I'd like problem-based learning. I think it's problem-based direction of what you then learn. It's not learning to solve a problem. It's a different thing. And I think we really do have to go to how do we support people working in teams as they would in real life towards solving problems. Yes, you can use online tools. Yes, you can use textbooks. They all have their role. But the apprenticeship models, I think, are still so important, and we mustn't lose that from medical education. So I know that's a comment, but I'd be interested in your views on that for these different platforms that we're talking about for sharing knowledge. Thank you.
Helen, that's absolutely wonderful. I think you think just exactly as I do. It's just so important. I mean, one of the things that I'm worried about Gideon and his background.
Don't worry about it.
It's wonderful. You've got an IT sort of computer, sort of mathematical man. You've got an anatomist. You've got a linguist, and you've got a clinician here. Who thought of this combination? It's brilliant. But you're absolutely right. What you're faced with the patient, what nobody actually puts into the equation is experience. So you and I can go on a ward, and we get, within the first 30 seconds, probably we know each system and roughly what the diagnosis is. The next 2 minutes, probably in our minds, got the diagnosis already from a vast differential. And the rest of the interview is really just checking out and making sure everything's all right, or examination to see what. So we've already got that, but we can't impart that to the students without your experience and my experience of the years that we've been doing it. And I don't know how you're doing, but what's worrying me about Gideon's model is that it's going to stop people thinking. Because it's going to be very mechanical. You don't have that background, as Helen was saying, of having the anatomy, physiology, and so on in the background, to be able to work out what's going on. Because if you're breathless, it could be a million causes. It could be, COPD, it could be a pneumonia, it could be a tumor, it could be anything. It could not the chest, it could be the heart, or anemia. So, how do you work all that out? And that's where I think we need to, our own brain computer with all that you've taught us in medical school will come into being. I don't know how your computer is going to work with that.
My computer is absolutely not going to do anything in that sense. But so let me make one a critical point, I think, because the way we look at digital learning is all about empowering the teacher and the students to work together more effectively for the learning outcomes. And I think that that's the critical point. I mean, let's put this teacher again in the center of this all. And the teacher is, on the one hand, I mean, the lecture has a place and a value in inspiring our students and showing leadership and showing them what is possible. But in a classroom, you also want that guidance, the guide on the side approach, the person that teaches you those different ways of thinking, that brings in the different language as you mentioned, or is able to determine the types of assessments that we place in students, not to overload them, not to underload them. And I think digital technology is very well placed in providing a platform in doing so, with additional benefits. So it's really about the virtual and the physical meeting. Cyber-physical is a term that I would like to coin in that sense, where that works really well together. And it's really about how do we empower teacher. And a couple of things that I want to emphasize in terms of where technology is really of benefit or can be of benefit. One is, in terms of student engagement and online discussion forum, students are students who usually don't speak up in a class like this will speak up on a forum and will ask each other questions and will answer each other's questions. At the same time, that creates a certain transparency. And I had one professor who said, "Oh my God, could you please shut the forum down because the students are explaining it to each other wrongly," with this idea as if they wouldn't do so when they meet each other. You know, but now you have this transparency, so you can actually do something about it. And that is where learning becomes also data-driven. And you have real-time analytics where we can actually see where students struggle with particular questions and go back to a video and say, actually, the way we explain it here can be changed. Or maybe in the textbook, we need to change a certain thing. And at the same time, I think this is more distant learning in some cases than when you're actually with your laptop up close and personal with that one person that guides you through some of the content. And at the same time, it's at your own pace to a degree. And where is the physical university in this? Well, it's for conferences like these, where I hope a lot of students get to attend, to talk to the people that make the science happen. And it's about the classrooms that you've set up, right? Where students really work together on problems and interact with each other. And all of a sudden, the space, the physical aspect, gets a different connotation, and you can do many, many different things that you otherwise wouldn't be able to do. So I think it's a broader set of opportunities.
I'm sure this conversation can continue for quite a bit, and I don't think that we'll find consensus completely, but perhaps that's the point. I want to take another question from Prof. Jan, standing in the aisle.
Hi, Jan Koster-Duke, Senior Advisor in Medicine at NTU. Parveen, I think you gave a brilliant exposition of what a textbook is, and that really is the assimilation and editing of knowledge by experts, presenting it to others. And I think this is the necessity that we need for the future. There is far too much knowledge out there in the internet today. We absolutely have to have a system where there is curated knowledge from experts made available, and send this message across to the students. How do you evaluate the knowledge that is available? We see today patients, and even more families of patients, come with knowledge that they have found on the net and driving them in particular directions. In other areas, this has really taken over. I mean, the whole essence of false news now has really become a key part of our society today. So knowledge is both positive and negative, because the knowledge that is there is not evidence-based, and it's really putting across the value of evidence base and how one creates evidence base that I think is needed for the future. So textbooks in some form or other have to be there in the future. I remember when I first saw team-based learning at Duke NUS, where the essence of team-based learning is that the final part is an application exercise, which is open textbooks in the way it was performed at Duke NUS. It was very interesting to see that the students at that stage were not going back to the textbook or the lectures they had online to look for their knowledge. They were going out on the net and they were looking for the simplest form of knowledge available, which was not curated knowledge. So this is a real problem that we have today, both within the profession and, more important, in the community. So how can we create this base that is needed for the future?
Sorry, if I can just give you a small example of actually the work that Helen Ward is now doing. And this is, I think, the way universities can play a role in this big, complex problem. And that is that we have a physical master's in public health. We can only admit 60 students a year. And we have so many applications that we cannot handle more. And we also know that there's a global need for people with public health degrees globally. So Helen and the team have taken upon herself to open up the degree in such a way that all the content is open for everyone to take. So essentially that's curated knowledge, like in a textbook, but open for everyone to take for free and reuse in a university setting or in a clinical setting or however you want it to be. And also the ability to take it online for credit at Imperial, of course, and that's I guess the technological and physical challenge, like how do you scale this type of quality? And that's the challenge that the team in public health has taken upon themselves. And I do think that is a movement that will grow further. And that's kind of like the university version of the open access movement, perhaps. And yeah, I hope many of these degrees will come out that are not only closed, but also help democratize a lot of the curated knowledge, as you say, across the world.
You talked about the importance of curating knowledge. First of all, Parveen, may I just correct you? You just elevated me to a dizzy height of being an anatomist. I actually had to do resits in anatomy. I'm a family medicine doctor, and this concept of the patients having knowledge. You talked about genomics, and it took about 10 years to actually work out the human gene profile. Because of the state of computer powers. Now it can be done in about 2 weeks. And one of my family medicine colleagues in London had a patient, a Mrs. Smith, who came in and presented to the doctor her genomic profile with all the risks of the conditions that she's got. And my colleague was completely nonplussed. He didn't have any of this knowledge, looked through it and then, found something that gave him a great sigh of relief, and it said, Mrs. Smith, it says that you're at risk of prostate cancer. So you could hand it back. So yeah, we do need to have that inherent wisdom that to curate the knowledge, yes.
I couldn't agree more. You've said what I really think very eloquently. From what you're saying, Gideon, what Helen's doing, that's curated information, so one should obviously take note of it. But there's a billion other things online. And as you say, they always go for the easiest, and that's usually wrong, by and large.
Fake news in the classroom, right?
Well, that's right. And the other thing about, is the press, really. Because the press controls society, it controls society thought, which then comes back to medicine and they tell us what to do. So every week there is a major, new advance. Well, we know one comes every few months or years or whatever. So it's totally wrong, but the patients want to know about it. And, talking about your, the patient who turns up with reams of things off the net, and your heart kind of sinks and thinks, well, this is going to take a bit of time, and there's sort of 20 people waiting outside, and you say, and I remember one lady coming in saying, very nicely, look, my nephew's looked all this up, and here it is. An elderly lady. She had Elizabeth around you, and she had problems, which is a thing where you bleed, the vessels bleed. So she had lots of spots all down her gut, and they all were bleeding, and I was carefully getting them lasered so that she wouldn't bleed. But she also had lesions in the lung, which again, we'd put a little coil into the lung to where the lesion was bleeding. And it's all doing very well. And she said, well, this new drug, And I said, well, yes, thank you. And, it was very interesting. Well, actually, we tried that 3 years ago, and it didn't work. And, this is the problem. The patient expectation with what the press says and what they see around is so high, and we can't support that.
We have 5 minutes more, so just a quick wrap up, and we'll go through starting with KK and we'll end with Prof. Kumar, right? The final word, yeah.
Okay, thanks. Not really a wrap up, but just to follow up on that point, which I think is extremely important. And the more we discuss this, the more it becomes clear to me that what our students need the most, really, quite apart from all the professional knowledge that they need to learn, all the communication skills that they need to learn and so on, is a critical mind. It's a critical mind because there's millions of bits of information out there on almost any topic. And, and you may have a curated knowledge website that is authoritative. On the other hand, there are numerous other websites who claim to be also curated knowledge of authority. The student, when he goes out, he needs to be able to make up his mind that certain sources of knowledge are more reliable than others. He's got to exercise his critical faculties. And these critical abilities are best developed when the students are in the university.
Which really takes to the point that, you've got to know how to know how to know.
Yeah, how to know, yeah, how to learn how to learn.
Yeah, which is your point.
Which is Gideon's point, and really to appreciate and understand that reality is not a simple thing. That there are multiple perspectives always, and one has to make up his mind in the proper context, such as the long list of possible diseases and illnesses out of a set of symptoms. I mean, who knows which one is the correct answer? The student needs to be able to apply his knowledge and skills in the proper context. And these critical skills come with reading and discussion and team learning.
Gideon?
So I think three things that I would mention is I want to come back. I think curation is really key, and that's where we have a role to play. The second, I really believe in this notion of democratization of the university and opening that up to other places, and maybe hospitals can take that up. And the third thing is about I lost my train of thought.
Never say 3.
Never say 3, right?
Don't put the number in because you might forget.
Yeah, it's the third point's probably on your phone, actually, Gideon.
Probably.
Tell us the fourth, and then you...
So it was open, curated, and the third thing I will leave up to suspense. Maybe if we can have a conversation after this.
If it comes to you, shout.
Yes, I will.
Just to sum up, I'd like to go back to something that Professor Suresh said this morning. It's about being nimble. What's coming across is this fourth industrial revolution is coming very, very fast. As things currently stand, if I want to make a change in my curriculum, if I have an idea today to make a change in the curriculum, the processes of the bureaucracy of doing that within our institutions, it's about 2 years before it comes into effect. And by that time, it's going to be too late anyway, because it's all changed. So I think there's something about looking at our institutions and still maintaining the quality and the processes, but how can we be more nimble?
I remember.
Oh, you remember. Eureka.
It's the teacher experience. Is how do we use technology to enhance also the teaching experience? For example, if technology can help us mark faster, and not do the marking the same way with 400 students, that'll create a lot of time and make people also want to teach more, I think. That's a...
Right, well, I think they've all said what we said. So really what I want to say myself, I'm just delighted to be here. Thank you, Naomi, for persuading me. I really didn't want to come. And Martin, thank you very much. But we are on the edge, I think, of a cliff. I think medical education is going to change. With the sort of things we've been talking about, it's going to totally transform education. We've got to be nimble, we've got to be thinking on our feet, we've got to be open-minded to be able to think how to think, we've got to learn how to learn, and we do need a good dollop of statistics and critical appraisal of what we're doing, which I think we don't do. And the other thing about education, I have a great problem. I've obviously done a lot of things with drugs. Now, if a new drug comes along, we put it through various phases, and we make sure it's, it's all right in animals, in vitro in animals and small and large populations. Then we put it out and then we review it. Now, with education, everybody has an idea, and the government thinks, right, let's go with that. But there's no piloting, there's no discussion about what was in the background, how you're going to do it, what are the resources, how we're going to implement it, how we're going to teach the teachers to teach. And none of that happens in education. If we can put in a dollop of statistics, looking at the important people in the front, into education, that would be brilliant. As I said, I felt desperately uncomfortable doing a talk without a p-value in it. I mean, it's a disaster. But I think we have got time for discussion, and it's been brilliant, and thank you for inviting me.
So thank you to the panel, and thank you, audience. I mean, as you can see, we have 27 questions submitted online, and a number of people didn't get to ask their questions in the aisles, but I guess these questions will have to continue over the rest of the conference. Could we have the MCs, please? And could we give the panel a round of applause?